Hi, therapy issuers. Thank you for joining in on our conversation between licensed mental health professionals. This is not meant to substitute a relationship with a licensed mental health professional. Should you become triggered or begin experiencing a mental health crisis, please go to your nearest mental health hospital, emergency room, or dial 911 or 988. And always remember, we are human first and therapist second. Follow us on Instagram, Twitter, Facebook, TikTok, and subscribe to our YouTube channel using the handle @Crave Counseling. This is Therapy-ish. All right, guys, we're back with another episode of Therapy-ish, and I have Miss Rebecca Opamen here with us today. And I'm going to have her kind of introduce herself, tell us where she's located, what type of services she provides, her preferred population, and where to find her. So can you tell us some of that?
So once again, my name is Dr. Rebecca Opamen. I'm at LE Mental Health in Bee Cave. Right now, that's off of Bee Cave location. We're also going to be expanding to 2 additional locations, one in Westlake and one in Terrytown. But right now, we're starting in Bee Cave, and we've been open for almost a little bit of a year. I personally see individual families and couples from the ages 5 and up basically, I'm open to anything and everything as far as backgrounds, diagnosis. I enjoy working with kids and adults. Doing family, couples things are also exciting for me as well.
Okay. Are you originally from Texas?
I was born in Shreveport, but I grew up in Dallas.
Oh, I'm from Dallas. Okay. When did you get to Austin?
3 years ago, I was a transplant, and I came right before the pandemic. And
Got
so before that, I was living in Lubbock. And so when I came to Austin, I was like, yay. And
more
then
people?
it shut down.
That's fair. All right. So today we're going to talk about working with the military. One of the things that Dr. Opamen was very adamant about for this particular topic was, I don't want to talk about resources. I want to talk about working with the actual population themselves, because you're right. There's not a lot of information out there in regard to even service providers. How do we actually serve this population? But even for the population not knowing what their services are supposed to look like. So the first question I have for you is, what is one diagnosis that veterans and active duty Army members always get misdiagnosed for?
To me, 2 that come up in my mind is PTSD and then traumatic brain injury, or TBI.
Okay.
So when I say PTSD, is that a lot of times there's symptoms associated with like depression or anxiety that a serviceman or woman may have. And automatically, the first thought when working with military personnel is that maybe they have PTSD, which I'm not saying that can't be something, but then there's every serviceman or woman's experience is different. Some people's experiences don't necessarily meet their criteria for PTSD, but they could be experiencing depression and anxiety. Mm-hmm. And then with traumatic brain injury, a lot of times people don't acknowledge that that's even something to put on the radar when we talk about symptoms that military personnel or veterans maybe experience or did experience when they were in active duty. And it's like, if you're riding on convoys or stuff like that, and there's jolts to the brain that you don't even think about, then it could result in traumatic brain injury, which can result in a variety of different things as far as impacting someone mentally, emotionally.
Yeah. And you were military, right? Mm-hmm. Okay. What branch did you serve under?
Army.
Okay. Cool. Were you ever deployed?
Yes. Okay. I did 1 tour under Iraqi freedom.
Okay. Well, thank you for your service.
Thank you.
We have another location in Killeen, and we try to specifically serve the military population out there. Okay. So what would you say is the best modality for working with service members, and how does it differ when providing services to service members using that modality? So, if you're working with a kid and you're like, oh, we use CBT with our teens. Well, how does that differ if they were non-military, non-service member families versus just general civilians?
So to me, you brought up one is cognitive-based therapy is one that can be beneficial. Any empirical based modalities can be useful. I'm expanding to other things, such as like I got trained in trauma conscious yoga,
Okay,
which
okay.
is something that I've been incorporating and has been very beneficial with working with military personnel or veterans and their family members as well. And then I'm also going to be expanding to do psychedelic informed therapy, so utilizing.
Ketamine.
Yes.
Uh-huh.
And that has been a lot of research in regards to supporting military personnel and veterans. They've been used, well, we're not talking about that. But those are some of the ones that come out. I mean, of course, like I mentioned earlier, like every person and their experience can look different, and I'm all about meeting a person at where they're at. When we talk about like what can really difference is like to me, if they show up and they said that they want to participate in therapy, it's like I'm a type of therapist that pulls out what meets their needs or what they're wanting to accomplish and can support those things. And so that question is kind of hard for me because I feel like I tailor it for them, and so it may look like different. Like when I meet them where they're at, it may be like I might talk to them a certain way versus somebody else, but that's because what they bring to the table and like incorporating a variety of different things that they feel like meets them at where they're at and what can kind of engage them in the therapeutic process. I guess
Yeah.
off top of my head, the only thing that I can think of is like understanding the military culture and understanding like how mental health may have been discussed or how it may have been viewed, and then also looking at that there is some common threads as far as in the military when we talk about how it's viewed if you talk about certain things, and so trying to provide a comfortable area where they feel safe to go there.
Yeah. Which it always shows up very differently in very different conversational spaces, right? Like when you meet people that are not in the military, they always mention, like, oh, they're faking. Why do you have a disability plaque? Nothing's wrong with you. You're just trying to get your disability. It's just like, baby, hold up. You do not know what I went through in this place. You don't know what my experience is. So you don't get to tell me that. But then you also have some people that are like, I don't want the stigma of it on my record or whatever the situation is. And then they're like, I do need help, but I don't know how to go about getting it because it could potentially have a negative impact on what I got going on.
Yeah.
So, and this is about to be an aside because you touched on it. Ketamine therapy. Did they change the rules on it? Because wasn't like a nurse supposed to be able to provide that portion of it, or did they open it up?
So that piece, like for me, I'm collaborating with another person to be able, or company or business to provide it. It is still that you would need like a nurse practitioner or a doctor or something if you're doing IV.
Okay.
But then you can also partner with other companies that maybe they do the lozengers. And then there's a thing of when we talk about psychedelic assisted therapy, then that may mean that the client comes in and takes the lozengers while in there and you provide integration or start the process that way.
And guidance through that. Okay. Because, yeah, that is a big one here in Austin. But there is a lot of research, like you said, on psychedelic assisted psychotherapy services. And a lot of the research was done on the military population. Yeah. I'm a reader and a researcher, so I be in everything. So I put my hands in everything. But thanks for bringing that up, and thank you for further explaining that, because some people probably wouldn't have even known what that is, especially if like they're a military member or a veteran that is trying to find what services are supposed to look like for them. Okay. So, what is one misconception that people have about, or clinicians specifically have about, working with the military population?
I think one that I would hear is like that they're resistant to therapy. And when we talk about resistance, like they wouldn't be engaged or they wouldn't participate. And I feel like it's not a thing about necessary resistance. It may be feeling comfortable or safe to even participate. And so when it's trying to address those things, there's still rules and regulations in regards to the military that can cause you to be excluded based on certain diagnosis and things like that. So it's just understanding, having an understanding of how it works, or at least how it works with the military, and then trying to work within the cracks to
Yeah.
still support
Yeah.
them.
They say read between the lines. We're working between the lines.
Yes.
And I'm going to make sure you are good and taken care of, because according to my code of ethics, my job is to support you.
Yes.
So let's talk about the reintegration process. I absolutely love working with families that are going through reintegration. Now, some clinicians shy away from it, but I absolutely love it just because you actually see two different parts of the family trying to become one again. And yeah, but that's neither here nor there. Okay, so let's talk about reintegration and the impact counseling has on that journey for military members and their families. So I know, again, you kind of have lived experience with being out and going on tours, or even just being stationed in different areas around the world where you're not with your family. So tell me a little bit about like what clinicians can actually do to support these families, and what can families expect in reintegration therapy?
So to me, that's something that is really one of those things that I feel like is important to advocate, because when it comes to coming back from a deployment, it's that's what I struggle with personally, in a sense of reintegration back into society. So for clinicians is understanding. I keep going back to understanding in a sense of like not everything is rubber stamped in a sense of everybody's experience, but understanding when we talk about military personnel, talk about like it being like a bubble where everything that you need and stuff like that is given to you in that environment, or provided in that environment, and then to come back to civilian life and it's different. So acknowledging that there's a difference in how civilian life looks, how the process is work in the civilian world. And so the integration piece is understanding that they may need supports and resources when it comes to how do I navigate these things? How do I support myself in these different environments? And so I think it's also important to note that what resources are available, what resources can support, because like sometimes when you're coming back, you may or may not have benefits that can support getting into therapy,
Yeah.
and being able to use it with all therapists and things like that.
This is true.
And so, and so that may mean like, I mean, trying to support them with utilizing like a sliding scale, or being willing to understand that there are differences in the sense of like their insurance, because like with TRICARE, Humana and stuff, you have to have a pre-authorization, and sometimes when you talk to servicemen or women about getting a pre-authorization, then it's like, oh, I don't know if I want to do that kind of thing. And so what are you as a therapist willing to do to work with them in that situation?
Yeah. One thing that you touched on in retrospect to reintegration is you said that in the military, everything is given to you, or you are operating within a system where you have all that you need. That's not always true for some, but it's there. I may not have been taught how to get it. So when the reintegration piece comes about, the one thing that came to mind as you were saying that statement was you're also told what to do. So now I'm adjusting to, I actually get to make decisions on my own. I actually get to choose my own healthcare provider who you guys don't tell me I have to go to. And so that in itself is big.
Yeah.
Like you said, the resources, but even teaching autonomy is really, really big in the reintegration process. But in retrospect to families, like a family unit, such as maybe I was deployed and I came back and I got, a husband and these kids that don't know me because I did back-to-back tours. So it's like in those situations, what can clinicians do for the family that's been here to help prepare them for reintegration?
Some of that, cause like I'm a firm believer, like even if you're not deployed with the serviceman or woman, is that you're still deployed while they're gone. And so that's the thing about having where the whoever's left behind is running things and controlling the household, and then their family member is returning. And so this is a different dynamic. And so in those situations, I think it's important to assist with like coping strategies, skills, communication, because I'm also a believer that most of us didn't learn how to communicate or know how to communicate. And so giving those resources, fair fighting rules, understanding that in the military how they communicate is a lot different than
But it might not be. It might not be
well,
if you
may
got a
not,
toxic spouse.
maybe not. You're right,
It
but
may be the same environment.
you're absolutely correct.
Because we see that too.
Yes, and I guess it's like I mean, as a black female or a female that was in the military in general, it's a difference in. It can be, not always, but it can be a difference in how that communication looks like in that environment and how expectations are communicated and things like that.
Yeah.
And I just feel like it can occur in the sense of in civilian world as far as how people communicate, but it's like it adds a whole different layer or spice to it.
Absolutely.
When it comes to actively being in the environment.
Absolutely, because you've been gone all year and you want to come back and tell me that I got to wash these dishes and my mama been washing them all year long? Absolutely not. Now we got a problem. Now we got a problem. And you have no understanding because in the military, you are the superior.
Yeah, ranks and things like that. And so some family structures do operate in that manner, but not all. And then when you try to incorporate that in civilian world, that's not necessarily going to mesh well a lot of times.
Yeah. Oh, I could go down a whole rabbit hole about that statement in itself. Like, what does leadership look like in your marriage? How does that show up? But that's neither here nor there. I digress. Because a lot of times when people do get married, when they go into the military, you know, you're taught to, well, that's what people have told me. I'm not military, that you're taught to get married. And so you're taught to get married, but you're not taught to structure your marriage when you go in. So you go in married and you come out divorced. Because you're not given the tools that you need so that when these reintegration pieces come back up, tour after tour, or, you know, wherever you get restationed, station after station, you know.
Yeah, and I mean, it's tough because when it comes to being deployed and things like that, the main thing that I always try to advocate is being able to process and cope with what you've seen and what you did. And so if you're not doing that or you're not actively working for that and then you come to the family unit with that, then that can really impact the family dramatically.
And what people don't realize, which is why I always grant grace to our military families, is they don't realize like there is no buffer period. You come back, you sign them papers, bye. Now you're back with your family for 9 months. And it's just like, okay, is there like a retreat that we can be sent off to as a family unit where we have family counselors and we have these yoga professionals and we learn some meditation and we learn to communicate effectively? It's just like, all right, you back. Okay. Your wife's sitting there waiting. Well, not always, but you know what I mean? Like the process happens like this. You're out and you're back in your unit and there was no setup.
Yeah. And that's one of the things they have some family, things that are similar to maybe what you're describing. Now, is it readily available? No.
No.
The trauma
Especially not to the Army.
Yeah, the trauma conscious yoga thing, they're starting to offer that to veterans and military personnel, but is that readily available? No. So
Yeah. And one in the Army would always say not all resources are equivalent amongst the branches.
correct.
Because we all know the government's favorite.
Yeah.
We all know the favorite. Okay. So what keeps members from seeking services and how should members go about accessing care without the military being involved? And I think you kind of hinted towards that earlier.
It's hard, and it's really difficult, like coming back. And when I came back from my tour and then like being in a large room with like over 300 soldiers and they're asking like, hey, do you have nightmares? Do you have trouble sleeping? And everybody's laughing. And it's like, no, we don't. We know like data and research shows that a majority of people that were in that room probably had symptoms or signs that were associated with the questions, but they didn't respond to it that way. So coming back and you're still in, and it's maybe having conversation with civilian therapists about, hey, like, hey, I don't want a diagnosis or formal, and of course that means that you can't use insurance, but that means you use other codes or to try to still be able to seek services. There are some nonprofits and things out there that could benefit you where they're not going to communicate those things, but it's tough. And then there's the whole thing about, like, if you do get help, you do get medication and things like that. How do you navigate that if it's something that's beneficial to you?
And the answer is usually you just don't.
Correct.
We just not gonna do that.
Yeah. And so there are groups out there for personnel too. And so it's like trying to use those things. I wish there was more resources and things available to support the servicemen. There are people out there that are actively trying to change laws and things to make it where those restrictions aren't necessary there, because like you said, they don't, or they're actively having these symptoms and diagnosis and they're just in the military.
Yep. And then there goes my rank. There goes me being honorably discharged due to medical reasons. And this is my world. This is all I know. So it's like, do I run the risk of, depending on what the diagnosis is, like some things are just not as stigmatizing as others, but some could get you out of the military like overnight.
Yeah.
Well, of course, we know nothing in the military happens overnight, but you know what I mean. Okay. What should families know about when their child decides they want to go into the military and that child has been seeing a therapist? How does that impact the military admissions? So it may look different for a 17-year-old in comparison to an 18-year-old.
I mean, that's factors. And then I think I just heard recently, like, one thing, because I had one client that was wanting to go into military, and they said, like, hey, you can't be on you have to be off of antidepressants for a year. So there is some rules with that. There are rules in regards to personality diagnosis, schizophrenia, bipolar disorder. Those diagnoses are ones that could impact you being able to get in. There's different branches that have changed legislation in regards to what can be allowed, where it's not automatically you can't get in. But I guess my biggest recommendation is have a conversation with a recruiter, and it may not be a thing that you can't get in. They may have rules in regards to when you can get in.
That's good to know, because when you turn, if you're actively receiving services on your 18th birthday or beyond and you have a diagnosis like schizophrenia or bipolar, a lot of clinicians don't talk to their clients about the ramifications of having a diagnosis. So a lot of times, even when I work with children, the day that they turn 18, I'm meeting with them. Hey, let's talk about how this diagnosis can impact you. Let's talk about who can access your information, because again, if you're using insurance, it's free game.
Yeah.
It's free game, which is why I pretty much put the question in there, is because a lot of kids, 18, senior year, maybe they turned 18 in January and they're still getting services. Well, if your mom is still billing, your clinician is still billing insurance, then when the military requests a copy of your records, it's going to be in there. So a lot of kids aren't even mindful of that. And then now we're in this place where we have a spike in suicides amongst our youth. And so it's just like, if you have that R code in there, baby, I don't even know if you're going to make it.
Yeah.
Even if it is a waiting period.
Yeah.
But I like that they added the waiting period, because I think before it was like a no-go period. Okay. So I think the biggest thing in that question is just making sure families are aware of, at 17, they might be good, but when they hit that 18-year-old mark, you might want to be more mindful of how you're paying for services.
Yeah, absolutely.
How does therapy benefit military members. So many people choose not to seek services, but a lot can be said about the positive in regard to therapy for our active members and our veterans.
Yeah, absolutely. And I think some of the things in regards to acknowledging the benefits is like when it comes to, of course, the stresses of being active in the military, the production of cortisol in your body, and things like that, and being aware of that, utilizing mindfulness, breath work, meditation, movement can support you while you're going through, if you're deployed, if you're in active duty and you're stationed somewhere, utilizing those skills can be beneficial in a sense of coping with the day to day grind of being in the military. And that can overall support the success or productivity that you do have in whatever you're doing, as well as acknowledging the mind, body, and so connected. And like if one's off, then it's going to dramatically impact you in other ways. So therapy in general, I want people to get to the point that they see it as the same as going to the doctor, going to the dentist for checkup. It's not a thing of, hey, there's something wrong, but it's a thing of, hey, I'm going in and I might just have a place, safe place to talk, or a place where I can pick up skills that can support me. And so ultimately, it can just also benefit them as far as learning communication and boundaries and things like that.
What boundaries? They don't teach you. They don't teach you boundaries in the military. They teach you there is no such thing as boundaries.
Well, I mean, picking up the ability to navigate the boundaries, because you can, I mean, you are correct, but I feel like there's still opportunities where maybe some boundaries could be utilized in regards to not feeling like you're overextending yourself more than what you really can handle, just because you're wanting to go for something or get something in the sense of promotions and things like that.
Yeah, I was just joking. I got plenty. I got plenty of friends that got boundaries in the military. I'm talking about no go, and so yeah. Okay, well, thank you for sharing all of this information with us today. Hopefully, more and more people can, like you said, become comfortable with being okay with seeking services. Again, there are some things that could impair your trajectory within the military, but there are ways around it, like you mentioned before, sliding scale, choosing to do cash pay versus insurance, and then just opting out of using your benefits, so to speak, or even, finding agencies that service military members and veterans for free so that, there is no paper trail. Not that we're trying to not have one, but yeah.
Yeah.
All right. So, with all that being said, do you service military families? Okay.
Yes.
Because I've come across some clinicians where they just are like, my experience in the military was so traumatizing that I just can't.
No, and that's understandable. For me, I love working with veterans, people that are active in the military, and their families. That's something that I'm comfortable with doing.
Okay.
For sure.
Okay. And then you offer virtual services for anybody in the state of Texas. Are you licensed in other states as well?
Right now, just Texas.
Okay.
Looking at it, but haven't jumped out there yet.
So if you're stationed in Fort Cavazos, now that it is no longer Fort Hood, what is it? Marlboro. What's right here in Austin?
I don't know that name.
I think
but I know
it
where
starts
you're
with an
talking
M.
about.
I can't remember the name of it. And then, Fort Lackland. If you guys are stationed out there and you're looking for a provider who is not necessarily in the military but have had, or that is lived experience, or has been that is a veteran, here you are. You have Dr. Rebecca Opamen.
You did it.
Again, I apologize that I did not lead with doctor at the beginning. My apologies. But okay, so tell us where you're located again. Tell us if you have a website, spell it out if you can. If you have social media platforms where people can actually follow you as you talk about different topics, that would be perfect.
So I'm at Ellie Mental Health in Bee Cave. This, as far as like our social media, we have Instagram and Facebook. If you Google or look up Ellie Mental Health West Austin, then I'll pop up. The website is kind of complicated, but if you Google Ellie Mental Health Bee Cave, will come up.
Okay. Well, again, thank you so much for joining us today, and thank you for your transparency, and thank you for being open to talking about mental health services in regard to our military members
No,
and
and thank you
veterans.
for allowing me to.
Absolutely. All right. So that's it for this episode. Thank you guys for tuning in, and we will see you guys the next episode.